Today, I want to talk to you about a few things. First, where we are with the COVID-19 pandemic here in Santa Clara County, what this means in terms of where we're headed. And I also want to tell you a bit about the order that I'm issuing today, which marks the beginning of a new phase in our local response to the virus. In recent weeks, we've seen a continued and now accelerating increase in COVID-19 cases in our county, in surrounding communities and throughout the state. Although we're testing much more than we have been before, these numbers reflect a true increase in the prevalence of COVID-19. And especially in Southern California, what we're seeing reflects an exponential growth in transmission that will be extremely difficult to control and bring back under control. Here in our county, we've taken a careful, measured approach to reopening, and we will continue to be cautious. We will also stay focused on protecting our most vulnerable residents and communities. This virus has proven time and again in communities around the country and around the world that it will come back with a vengeance if you let your guard down. We will not let our guard down here in Santa Clara County. Over the last 2 weeks, we've had fewer cases of COVID-19 per 100,000 residents than any other county in the Bay Area and fewer than any other urban region in the state. But even our rates are increasing, and our daily case counts today are much higher than they were at any time in April when we all came together to flatten the curve. We must each take responsibility for protecting ourselves, for protecting our families, and for protecting our entire community. Just yesterday, the governor took action in communities throughout the state to close down activities that create great risk of COVID-19 transmission, and I am extremely grateful for his leadership in doing this. Those activities were never reopened here in our county, and unfortunately, many are ones that cannot resume safely here or elsewhere anytime soon. We're all coming to recognize that certain activities just can't be done safely at this time. There are, however, other activities that we can resume in limited ways if we do them with appropriate and consistent social distancing. So we're at an inflection point. We're at a point in this pandemic when it's crystal clear that COVID-19 will be with us for a long time. And so we need to adapt to a new way of being, a new way of living that keeps us all safe and that allows us to do some of the things that we miss and that we cherish and that we find most meaningful. But we also need to take into account the realities of human behavior and the fact that some activities are open in communities around us. By allowing people to do certain activities with strong protocols in place, however, we can ensure that they do so safely. So to further these goals, today I'm issuing a new order, and this order is designed to guide how we approach activities in our county for the months ahead. This marks the end of a phased reopening and the beginning of a new stage that we anticipate will be stable for some time. It will allow many activities to occur if appropriate risk reduction measures are in place, and that includes personal care services like haircuts and also smaller gatherings. But of course, many high-risk activities simply cannot safely go forward anytime soon. This order will require us to obtain approval from the state before it can take effect under the requirements of the state's COVID-19 roadmap. The order will go into effect on July 13 or as soon as state approval is granted, whichever is later. This will give certain businesses that are not currently open the time that they need to prepare to operate safely and to train employees to comply with the strict social distancing protocols they must have in place in order to open. Our approach from the outset of this pandemic has leveraged tried and true public health strategies, has been careful, and has been based on the continual assessment of relevant data and our evolving scientific understanding of this virus. We've also carefully weighed the evolving circumstances in our county, in our broader region, and globally. There's no doubt that this pandemic has created tremendous suffering and uncertainty for everyone, and has laid bare the disparities in our society, and has created devastating social and economic consequences for people locally and across the world. But the only way we can get out of this is to simply stay laser focused on containing COVID-19. And I believe we can do this if we stick together. I'm very proud of our community and what we've been able to accomplish together over the last many months. And I know that we will continue to pull together and support one another as we move forward in the weeks and months to come. Thank you again for being here. Again, it's a pleasure to see all of you in person. Thank you. And I'm going to turn it back over to James Williams, our County Counsel.
The new order that Dr. Cody is issuing today is organized around several core essential principles. These principles are not new, but this order makes them more uniform and consistent and applicable across the board. The goal is to try to set a new normal for what we can expect when we enter any business facility or engage in any kind of activity. These principles are that outdoors is safer than indoors, more physical distance is safer than less distance, fewer and briefer contacts with others, safer than more or longer contacts. Face coverings should be worn consistently and become the new normal. And some higher risk settings just cannot safely open at this time. Foremost, the order acknowledges that the safest thing to combat COVID-19 is still to stay home. And for older adults and those with underlying medical conditions, the order urges them to continue to stay home except for essential needs. Also, all activities that cannot be done with social distancing are generally prohibited. For businesses, the order places nearly universal requirements. Again, the goal is to have consistency so that all of us, whenever we enter a facility, can have the same set of expectations as workers, as customers. One, we have newly updated the social distancing protocols. These protocols are now a little more comprehensive and detailed. They must be submitted under penalty of perjury, and we've created an online web portal for their submission so that they can be accessible to the public and reviewed, and so that we can also keep track. Second, across the board capacity limits of 1 worker per 250 gross square feet of a facility and 1 customer per 150 square feet of space open to the public. Third, a requirement to report positive cases at work sites to the Public Health Department. This will allow the Public Health Department to more quickly do case investigation, contact tracing, to deal with any outbreaks that might occur in a workplace. Fourth, to follow industry-specific directives, and there will be some for certain categories of businesses or activities that will be issued next week. And finally, to continue to maximize telework. These 5 key items are again applicable universally across businesses and not different for different kinds of sectors or different industries. Some higher risk businesses, however, will remain closed. In particular, because individuals must strictly mask indoors, indoor dining, indoor swimming, and other activities that would inherently require removing a face covering remain prohibited. Also, places that would promote close or large gatherings, such as nightclubs, theaters, stadiums, arenas, will remain closed. I want to note a couple other important things. Folks probably heard the governor's announcement yesterday, and we're in an increasingly complex state regulatory framework as the state also continues to focus its energy on tackling COVID effectively. This order makes very clear, as all our orders have, but again emphasizes that everyone in the county must follow the state orders and state guidance whenever it may be stricter than the local county order. And that is also true of any specific industry directives from the state as well. Finally, because of that state regulatory environment and framework, this order will go into effect no later of either July 13th or when the county obtains state approval, which is being requested today. That means that businesses will have time to put these measures in place and fill out the new social distancing protocols and ensure that they can actually modify operations to be consistent with these universal requirements. But it also means that we don't quite yet know exactly what that effective date might be, and we will of course keep people updated on that. The guidance, the additional industry directives, so forth, will all be available on the Public Health Department's website. We will be completely overhauling the frequently asked questions as this new order comes into effect because it is a different framework. That all being said, until this order does go into effect, we also want people to know, and that applies throughout, for example, this 4th of July weekend, that the current order, the current shelter-in-place order, remains in effect and unchanged at this time. With that, I'm going to turn it over to Supervisor Cindy Chavez, President of the Board of Supervisors.
Well, good afternoon, everyone, and it gives me a great pleasure to be here with two of my colleagues. I'm going to be asking Vice President of the Board, Supervisor Wasserman, to speak, and then Supervisor Dave Cortese, and then I'll be cleanup batter. I think that's a thing. All right, so Mike, I was trying to do this in the vein you like.
Good afternoon, everybody. Getting people back to work and reopening businesses safely is paramount. I want to express my strong support for the steps our public health officer is taking today. This new order allows additional businesses and activities to resume while setting standards to keep our community safe. Our success in fighting COVID-19 has always been about us as a community, our businesses, our workers, our residents. We all need to do our part to follow these guidelines and keep each other safe while we continue to reopen. Our businesses will need to be adaptable and flexible to comply with these important new safety measures. I'm confident they will be. The health of our community and economy depend on it. In closing, let me say, I'm hopeful that the governor and his team will recognize all the work that the people and businesses of Santa Clara County have done to reopen remaining businesses safely and approve our request. Thank you very much. And with that, I'll turn it over to Supervisor Cortese.
Well, good afternoon. Thank you. Thank you, all of you in the media, and I want to reiterate something I've said earlier in this process over the last 3.5 months. Those of you who are here from the media have done a terrific job of essentially creating a massive public service announcement for those of us in government and for those in the public health departments particularly to get the word out to people. There's no way to get 2 million people in a county like the county of Santa Clara or a place as big as the Bay Area to do the right thing and to do the same thing consistently without your help. And really that's my only message today, in addition to thanking Dr. Sara Cody, the terrific team of legal counsel that's been surrounding her this entire time, the rest of the folks in our emergency services office, but to to thank everybody for getting this far at this stage with the kind of safe environment that's been created relative to just about anywhere else in California and just about anywhere else in the country, let alone the world. That said, I think if I was any of you listening to this, I would say, are we going to an honor system at this point? Is that what this is really about? And I don't think it's an honor system. I think it's something a little bit similar to that, but certainly not an honor system. And certainly, as we just heard from legal counsel, there are still strict legal requirements for compliance in a number of ways, including shelter in place. But I think we are going to a peer pressure system in a good way. And oftentimes, growing up or talk to our own children, we talk about the pitfalls of peer pressure, but this is an area where peer pressure has to be the one thing that holds this all together. And we hear over and over again from people questions like, I don't know if I need a test or should get a test or who should get a test. And what peer pressure should tell them is getting a test is always best. Just keep it simple. Just keep it simple. And we hear people saying, should I wear a mask or not wear a mask? I'm not sure what the rules are. And peer pressure should say, if you want to meet without a mask, don't ask. That's the kind of peer pressure we need now. And that's the way we need to operate, I think, in terms of beginning to keep this new normal as simple and clean and clear-cut as possible. And we just heard that distancing is going to be critical to this next phase that we're about to embark on in terms of trying to keep everything as safe as it's been over the last few weeks going forward. Distancing is critical. And I think the kind of peer pressure we need around that is, if you're not willing to be at 6 feet, then we don't meet. It's really up to the community. And I think we know that, and I think I've said that to many of you in my own discussions and interviews with some of you who are here from the media. None of this would be working at all without the cooperation, the voluntary cooperation of the 2 million people in this county. And the simpler we can keep this, I think the more likely it is that we're going to have success. So I really, again, commend everyone in the Emergency Operations Center. That's what I was trying to say earlier. And particularly Dr. Cody and the folks that are surrounding her for moving to a system that is simpler, but still effective. Thank you.
So just to wrap up, I think that the way I've been thinking about this is that this is the next phase of our battle against COVID-19. And here are the really simple things we have to think about. We know that cases are on the rise, even in this county. So we're making changes that are about risk reduction. And what that means is that as a community, we need to hunker down and we've got to lower these numbers, even while we're opening things up. Why is that so important? For every parent at home that wants to see schools open, and every baseball fan that wants to go to a game, and every Warriors fan that wants to get into a court, these are only going to happen if, as a community, we start to push these numbers down. So I'm going to give you an opportunity for everyone to start to stand up and figure out how to do this as a community in this new environment. We know that we've had more people in our community testing positive for COVID-19 since we've been opening up. And there are two things that we've seen. We've seen clusters in workplaces, which means that we're going to rely on our businesses to be ruthlessly disciplined about following the rules that you say you're going to follow in order to be open. So that's bucket one. Bucket two has been people meeting with their families and friends. And this weekend is 4th of July. And if we're not careful, 14 days from now, we're going to start to see people in our hospitals. But all of us, all of you can do something about that. And what that means is following the rules that Dr. Cody has laid out for us. I want to say just one big thank you to all of you who've been sheltering in place, all of you who've been wearing your masks, and to say to everybody else, join us, because this is the only way we're going to fight this if we do it together. We want kids back in school. We want our lives back. We're going to have to work together to make that happen. The last thing I wanted to say is that really for all of the volunteers out there who've been making food available and delivering and volunteering, for our contact tracers who are volunteers, a very special thank you. To the people who've been working in emergency operations across this county, thank you. And I feel bad saying this, but thank you to everyone, and now we need you to all do more. And that includes everybody in this room. So with that, I'm going to turn it over to David Campos, our county executive, who's going to handle questions and answers.
Thank you, President Chavez. Good afternoon. My name is David Campos. I'm a Deputy County Executive and serve as Public Information Officer for the Emergency Operations Center for the county. We are going to take questions, and just to note that we have reporters here. We also have reporters on the line, so we'll begin with the folks that are in the room and then follow with folks on the line. We also want to note that following the press conference, we will have speakers available in different languages, including Spanish, Vietnamese, and Chinese, so that the diverse residents of our county can have information in their language. So please let us know if you'd like to interview anyone in those languages. So with that, let me begin by taking questions. Yes?
Dr. Cody, last week you cited hospitalizations as a barrier for regional variants, that landed the county on the state watch list. Just wondering what changed.
So this is a question for Dr. Cody, and I'm going to repeat the question so that folks that are watching as we're live streaming this on Facebook can actually hear the question. The question is, last week, Dr. Cody, you cited hospitalizations as a possible impediment to the state approving a variance. What has changed?
Thank you for the question regarding hospitalizations. We are on the state's monitoring list because of the change in our hospitalizations. And so we do, that puts us on the list. But what I want to provide is some context in that it's about the change in hospitalizations. And in our county, we still have relatively few people with COVID in the hospital. And so you can think of it as going from very low to low. But the change was enough to land us on the list. Thank you.
Next question, yes.
Dr. Cody, can you elaborate a little bit when you talked about factoring in human behavior? And is this somewhat of a test for the public to see if they can actually handle a reopening?
So the question for Dr. Cody, can you speak to the issue of human behavior, and is this a test for the public in terms of their ability to handle this test?
What this new order does is acknowledge that we have all been sheltering in place for a very long time, longer than we hoped or expected to do. And so we're acknowledging that there are parts of our lives that nourish us, that are important to us, that we need to do, and that we want to do. What the order does is set very specific guidelines and protocols for how to do so safely. So essentially it acknowledges that we are human, we do need to get out of our homes sometimes, and so the order makes it very clear how to do so safely, both how businesses can engage safely with customers and how all of us can engage safely in activities that we want or need to do.
Any other question, folks in the audience? Yes.
Dr. Cody, very quickly, please, not to change the subject, but recently there was a meeting of some administrators with the Santa Clara Unified School District where attendees may have been exposed. Are you aware of that situation? And if so, what are your plans for it?
So this is a question that has been asked of the county, and specifically here of Dr. Cody, about a meeting of administrators that took place. Are you aware of the situation, and what are you going to do about it?
Thank you for the question. I'm somewhat aware of the situation. And I think that what we would do is what we do in any case where we think there might have been an exposure and there might be people at risk, is that we assist and consult and ensure that anyone who is exposed gets proper follow-up, which includes testing and safely quarantining at home.